Are hospital emergency departments being abused by too many patients with non-emergency problems? Have they become centers of some of the most wasteful sorts of medical costs? These questions are being debated by physicians and some government agencies that hope to contain costs by limiting ER access. For instance, South Carolina's Public Health Institute and Massachusetts Healthcare Quality and Cost Council both hope to do this. One idea is to give patients 24/7 phone access to nurses and doctors instead of an ER visit. Another idea in Georgia is to jack up emergency room copays. We asked Dr. Zachary Mizell what he thought of this. He's an emergency room physician as well as Time.com's medical insider columnist who's written a good deal about this topic.
So people come to the emergency department for all sorts of reasons. Some are sent by their doctor. Some come because they think they're having an emergency. Some because they have no other place to go or they don't know any other places to go. Some of them are emergencies. Most of them aren't, but a lot of them could be. And so that's the issue. So when you frame the emergency department abuse issue as a problem, then it becomes how can we get people to stop using the emergency department. And one of the potential consequences or unintended consequences is that we will have people who need to be using the emergency department not coming. We already know that 50% of people who are having an acute stroke, for which time-sensitive care is important. In other words, if you don't get treated within 3 hours, you may have worse outcome. 50% of people who are having an acute stroke don't use the emergency department within a timely fashion. Same thing for underrepresented minorities who are having heart attacks. So if we put in these blunt measures to try to keep people out of the ER, we're going to screen away some people who actually should be there and for whom we could be saving their lives. In addition, we don't know how to determine ahead of time who's really having an emergency, and certainly patients don't. So if we put in these systems where patients can call a nurse or talk to their doctor, we think that that'll keep them out if they're not having an emergency, but it turns out that if most people whose complaints are things like abdominal pain and chest pain, which are the most common reasons people come to the ER, if they call their doctor or nurse or go to the Walgreens with those complaints, by and large they're probably going to be sent to the ER because they could be having something that's life-threatening. So these policies, these blunt policies, are probably going to fail.